Hello and welcome to the Downsize. My name is Lorraine Durham, and we're here recording live at the Obesity Week conference in Atlanta, Georgia. I'm here with Dr. Robyn Pashby, and this is the Downsize where we talk about all things GLP-1 related. I hope you will like and subscribe to the Downsize. Dr. Robyn is a doctor. She's not your doctor. I'm not a doctor. So if you're interested in starting any GLP-1 or weight loss journey, please consult your medical professional. Okay, so Dr. Robyn, welcome.
Thank you. Hi, everyone. I'm so glad to be here.
Yeah. I'm just a big fan of yours. Let me just fangirl for a minute. Big fan of yours. If you guys haven't watched Dr. Pashby's talk on the weight we carry, it's on our YouTube channel. It's on her YouTube channel. So please go check it out. Anyone who has been struggling with their weight will totally be able to understand and relate to that talk.
I've had so many people say, oh, I just broke out into tears the entire time listening. And my goal is obviously not to make people cry, but to encourage people to understand that their journey is not like it's not theirs to carry alone.
Oh, that's so awesome.
Yeah,
that's so awesome. And it's so nice to find doctors that understand. I mean, there are obesity medicine certified doctors.
Can you try cream soda? I don't think I ever tried it.
Just truly understand what it's like.
But yeah, these are great.
Have the disease of obesity and battle it, and that's so nice. After it seems like a lifetime of my doctor telling me, you just need to diet and exercise.
Here's what worked for me, right? Right. Yeah. Yes.
So tell us about what you do, Dr. Pashby.
Sure. Yeah. So I have a really unique position actually as a psychologist in this space. So there's so few obesity medicine doctors. There are even fewer obesity-related mental health professionals. Wow. And so we are a small but powerful group of people. And our goal is really to address not just the lifestyle things, which I think when people talk about obesity and mental health, they think, oh, you need help learning how to eat better or learning how to exercise more or manage your stress better.
Damn it.
And maybe that's true, but that's not really what I do and what we do. So what we do is actually work with people on navigating the mental health consequences of living with obesity, such as experiencing a lot of depression and anxiety after decades and decades of trying, dealing with internalized weight bias and the negative
know where that
self-talk,
body
those
scanner machine
things that
is?
you might say to yourself
Did you
when
see
you
it
wake up
or
in the morning and get out of the shower.
I saw it and I don't remember where it is.
What's wrong with me? Like today I'll do better, I'll be better. All that sort of negative self-evaluation. We really help to work on uprooting that and changing it for people, because what we know is that when people experience internalized weight bias, it actually interferes with them getting the care that they deserve. So it's really a medical issue, and it's just coming at it from a different lens. And I hope that people here will hear me say things like, when you tell yourself that you're a failure because your body looks the way it looks, or because you ate candy last night left over from the holiday, that actually triggers a nervous system response, the same nervous system response that gets triggered when, for example, you get in a car accident, or if you get mugged, like really traumatic experiences, because we have one nervous system. And it's the same nervous system that reacts to real threat and to internal threat, perceived threats, which when you imagine ever telling a little kid, you're a failure because you ate Halloween candy. And think about what that would do to them, right? But we do it to ourselves all the time.
Oh, wow, that's so powerful. So don't talk bad to yourself, right? And it's so easy. It's so easy to get into that negative self-talk.
It's just like under people's radar, right? I don't think people intentionally walk around trying to do this. But if you've heard it from, your mom or your grandmom or your doctor or your teacher or your coach, and you kind of can't help but think, well, maybe they're right. Or maybe if I did just try harder, or maybe if I wasn't so lazy, I watched a movie last night. Oh, I'm so lazy. Like, well,
that's that.
Right. At least become aware of how much it matters in your day-to-day experience, so that you can decide whether or not you want to try to work on that.
Yeah, I guess when we become aware of what we're saying, then we can make an effort to change what we're saying and not be so hard on ourselves. I think one thing I've always heard, at Weight Watchers specifically was, would you say it to a friend? would you say, you're stupid, you're lazy, or whatever to a friend? Of course not.
Of course not.
So why would we say that to ourselves?
Right, right. But I think in the obesity space, it gets really complicated because we have lots of respected medical professionals
Yeah.
that speak to us that way.
Oh, yeah.
And so it's one thing if we say, okay, right, I don't agree with what my mom said about this, or I understand that I would never say that to a friend.
Yeah.
But then you actually go for a doctor's appointment because you have knee pain. And the doctor says, well, if you lost some weight, your knees wouldn't hurt. What do you expect to learn from that experience?
That's so hard. That happened to my husband. He went in for an ear infection. The doctor wrote morbid obesity.
Yes. I have a client that went in for strep throat to urgent care and
Yeah.
left with a pamphlet about the bariatric surgery center in our town.
Oh, that's terrible.
I mean, she was like, I have strep throat,
yeah.
this is not meant, it's just so painful to hear. And I want anyone listening to think, what are ways that is affecting me? And what ways have I internalized that to have it sort of live inside of me still?
Yeah. And how do we start to unravel that?
Oh, it's so painful. I think hopefully by learning it, right? So education is power always. And remember that not everything that every healthcare professional has ever said to you over time is right. And when people are using their own personal experiences in healthcare to say what will work for you, question that, right? So if a doctor says, hey, what worked for me is this diet plan or eating this many calories, they don't know you. They don't know your experience. So I think it's really important to remember that lived experience is important across all circumstances, but no one is trying to give you a prescription based on a lived experience. And I think we need to be thoughtful like that. So that's one thing to consider. And then the other is recognize that if shame worked, we wouldn't have obesity.
We'd all be fine.
Right? Like this is just we wouldn't have mental health concerns. We wouldn't have HIV AIDS. We wouldn't have so many conditions that have been stigmatized and shamed over the years.
Wow.
It just is blatantly obvious that is an ineffective strategy. So why would we persist in doing it even to ourselves?
It's such an easy trap to fall into, right?
Yes.
I'm sure we all have examples that are running through our minds of times when a parent shamed us for being overweight, or a grandparent, or a doctor, or and it's really hard to move past that. But it's so important.
And I'll just say also that we also have plenty of data that internalization of weight bias, of course, affects avoidance of healthcare, like I mentioned, but it also increases the rates of depression. It increases rates of anxiety, it increases rates of disordered eating. And all of these issues, depression, anxiety, disordered eating, actually circle back and can then contribute to further weight gain. So we are literally talking about the vicious circle that everyone refers to, where weight bias and stigma perpetuate other conditions that then increase weight gain, which then increases internalized bias and stigma.
So what do you treat first if someone has depression and anxiety and obesity?
It's a really complicated question. And if you throw disordered eating in there, it gets really confusing. So what I tell my patients who often walk in and they'll say things like, I'm a hot mess, right? I'm really struggling and things like that. So first we address their way of referring to themselves. And we say, look, it is okay to struggle. You're a human being. That does not make you a hot mess, right? And so we might go there. But then in reality, what we think about is that it's confusing because a lot of times if we're going to go down a medication route to treat depression or anxiety, a very known side effect of many medications is weight gain and increases in appetite and increases in fatigue, a recipe for increased weight gain. So number one is I work really closely with my patients to make sure that any psychiatric provider is aware of what medications are more weight accelerant and what are more weight neutral. Because not all mental health medications are the same. Some have a lower risk of weight gain than others. And so talk to your healthcare professional if you are needing a medication to manage your mental health so that you can try to get the most weight neutral approach possible. That is hard because who wants to go to their psychiatrist or their primary care doctor and say, I'm really struggling with depression, but also I don't want to gain more weight, right? Because often a primary care provider will want to prioritize you feeling better. and think, okay, who cares if you gain 5 or 10 pounds? It's no big deal.
Oh my
But
God,
of
it's such a
course,
big deal.
to anyone who's ever struggled with this, we know it's such a big deal.
Right.
So number one is just be willing to advocate for yourself in that way and say, look, this is important to me. Even if it's minor to you, it's important to me.
Even if it's minor to you. That's
Yes.
a good one.
Right.
Yeah.
And then the second thing is really there's a lot of mental health support out here that might not be specific to obesity. But if we talk about shame, almost every mental health practitioner can talk to you about what it is like to live with shame. Because obesity is one chronic disease that has a lot of shame associated with it. It is not the only. And so when you're looking for a mental health support network, it might be hard to find someone who specializes in obesity. It might not be so hard to find someone who can talk to you about the life experience of living with something that you don't feel great about or shame. So that's another sort of sideways of getting the support that you need.
So I guess, how do we go about finding a mental health professional? Like, where do you start?
Really good question. So it's so state dependent in
Okay.
some ways because licensing regulations, there are psychologists like myself who can work across many states in the United States. Some people are restricted to their own state. So number one is knowing what location you're in and whether or not you want virtual care or in-person care. We now have that option in lots of places. Number two is asking about your insurance. So what insurance do you have and what are your benefits for mental health coverage?
Yeah.
Knowing that will, again, empower you to make an informed decision for
Right.
yourself if you need to use insurance benefit. And then the next thing would be to go to your insurance website if you do need to go through insurance and look for information there because they often have a list. However, cross-reference said list with trusted physicians, neighbors, other people. And again, what I'll say is if you feel ashamed to talk about your mental health care, you are feeling disempowered to advocate for yourself. And so what we want to do is empower you to have these conversations and say, yeah, I'm struggling. My mood is really taking a hit lately. I need help. Does anybody know of a good therapist? Like that
Oh my gosh.
normalizes the conversation about
Right.
mental health.
Oh,
Right? You're here trying to normalize the conversation about
About
obesity.
obesity, right?
And I'm out here banging the drum saying, yes, let's normalize the conversation about obesity, but also about mental health. Because
So-
everyone has mental health, every single person,
Right.
universal.
I need help with my mental health.
And
Like,
that
do you know
is
any good
okay.
therapists? Oh my gosh, like, yeah, that's just even hard for me to say.
It's hard to say, right? And
Yeah.
yet you sit across from me as a psychologist, and I don't think I'm so scary, right? I can have a real
Right.
conversation.
Well, it's that stigma, right? It's like, what's
Exactly.
somebody going to think of me if I'm admitting I'm having depression or I'm
Right.
having anxiety or I have a problem? Like,
Right.
I don't want people to think less of me.
And this is the same thing. So when you say a patient comes in with obesity and depression,
Yeah.
they are doubly stigmatized, right? They have
Yeah.
the stigma of obesity and they have the stigma of depression. And so trying to get that person in a place where they feel empowered to advocate for themselves takes a lot of work,
Takes a
a
lot,
lot of
work.
courage.
Right.
It is really
Right.
hard, but it is so worth it. You listening are so worth it. You're so worth asking for help.
Oh, that's amazing. Thank you, Dr.
Yeah.
Well, I don't want to keep you. I know you're a busy lady. here
Yes, I
today.
am.
Tell us about some of the sessions you're talking about
Sure.
here today.
Yeah, so I had a great session this morning talking about advocacy, the use of generative AI, and weight bias and stigma, talking about how prevalent weight bias and stigma still are, and then really trying to understand how generative AI may be both a tool and a culprit of perpetuating AI. And so that's something that I have a lot of interest in and we'll be exploring more. And then this afternoon, I'm doing a joint session with some amazing colleagues, and we're talking about the intersection of eating disorders and obesity,
Oh,
and what role do things like GLPs have in the treatment of obesity in someone with disordered eating.
yeah.
So we're going to tackle some really tricky questions that many physicians feel, a little scared to talk about.
Yeah.
And then tomorrow, I'm going to do some really cool sessions with an amazing group of multidisciplinary professionals, a physician, a registered dietitian, a physical therapist, and others, and talk about complex cases about, like people, real live examples. And then we're going to do some really cool things where we throw some curveballs in, because that's what it's really like to work with patients, right? Oh, your patient's doing great one day, and then you see them the next week and suddenly they've lost their insurance coverage, or suddenly this next thing has happened. And so how do you navigate those tricky situations with dignity and respect?
Do you see, in regards to eating disorders, do you ever see people with GLP-1s who then develop maybe a disordered eating pattern where they're not eating enough and they start losing too much weight, going too far the other way?
So I will say, this is a really tricky question. What I will say is that anything that suppresses people's appetite has inherent risk of undereating, right? I don't think that that's the universal experience for people, but I do pay a lot of attention to that sort of issue, and encouraging patients that I work with and that my colleagues work with to pay attention to their own eating habits and make sure that if they feel like they're not being, nutritious enough or not getting enough calories, that they reach out for help from their doctors or their mental health professionals. I think it's a particularly sticky topic. So
well, when you mention eating disorders, the first thing I think of is, anorexia.
Right.
I mean, maybe not bulimia with a GLP-1, but I definitely can see people, because they have control over their eating where they never had it before, and that's such a powerful feeling.
Right.
So just
and I think I'm sorry to interrupt.
Just recognizing that effect it might have on you.
Yes, and I think we, like you said, when I say the word eating disorder, most people think anorexia, and they probably associate that with like young white woman.
A girl in my high school who ran 3 miles every morning and wouldn't eat for days. Yeah.
So you think about it like that. And I think we have to be, one of my missions is to broaden our understanding of eating disorders and disordered eating so that people don't jump to those assumptions in the same way, because people of all body shapes and sizes, of all ethnicities, of all socioeconomic statuses can experience disordered eating and eating disorders. Food insecurity is a major predictor of eating disorders and disordered eating. So I want to sort of open people's mind to what that is, not just, people listening, but also healthcare professionals, because I always say one of the most common things that stands between a person with obesity getting diagnosed with an eating disorder is a clinician who forgot to ask, because we make a lot of assumptions based on how a person looks. And if we continue to do that, then we may not ask the right questions of the patient sitting in front of us. So that's a really important thing. And if you're struggling with and feeling like your relationship with food is at risk, you can see a mental health professional. You can also see there's some really great health coaches out there that are educated in the world of disordered eating. So there's a lot of resources at all price points and insurance coverage.
There's help out there. Yeah. And I guess the important takeaway is you can advocate for yourself.
Yes.
You can empower yourself to ask for help.
Yes. And there's so many good places to go learn more about that, like this channel is one of them.
Well, thank you.
Yes.
Well, thank you. Anything else you want to add before we wrap up?
No, I do encourage you all to go to the YouTube channel and watch my talk. It's called What We Carry.
Yeah.
And you'll see me wearing a big backpack in the still video or the still shot of the video. And what I hope that you will learn from that is not that you are in this journey alone, but in fact that there's a lot of us out here who understand what it's like to live with obesity, and that it has so much more to do with the size of your pants or the number of adipose tissue cells that you have. It's a really complex chronic condition that affects both our minds and our bodies.
Absolutely.
Yeah.
Thank you so much,
Yeah.
Dr. Pashby. I
Well,
just love listening to you talk.
Thank you. You're so nice. Thank you.
And thanks everybody out there for watching. I hope you will like and subscribe to our channel. You can also check out more on our website at thedownsize.org. And thanks for watching. And thank you, Dr. Pashby.
Bye, everyone.
We'll see you next time. Bye-bye.